we have Kanaga for discussion. She's a very good friend of mine, and she is a RCI licensed clinical psychologist and holds a diploma in transaction analysis and undergoing training of psychodynamic therapy and psychotherapy. She runs a support group for perinatal mothers, pregnant mothers. The details are given in the description. And also she currently working as a consultant in a Smriti Healthcare Hospital. You can reach out for her for any kind of support and therapy and counselling for perinatal mental health. So hi Kanaga, how are you?
Hi Josephine, I'm good.
Long time you're saying, isn't it?
I know.
Yeah, okay.
Been ages.
Yeah, ages. So I have seen a lot of work of yours. So you have been specialized in perinatal mental health. So today our discussion is going to be about perinatal mental health and a very basic understanding for layman people.
Yeah.
Okay. So what I'd like to start off with is, what is exactly the meaning of perinatal?
Right. First of all, I think this is a extremely important and a crucial topic that we are going to discuss today.
Very much.
I'd like to, like what you asked. So the meaning of perinatal is basically the few months before the prenatal period, that is during your pregnancy, and 4 weeks after your pregnancy, which is your postpartum.
Okay.
So perinatal period is like a overlap between your prenatal and postpartum. So the perinatal period typically starts at third trimester towards the 28th or 29th gestational week and goes up to 4th week of your postpartum. That's your perinatal period. That's what clinically we call the perinatal period.
Okay. So over here, how mental health is affected? How does a picture of mental health comes into this period for women?
Right. I think over the years we've evolved to look into perinatal mental health, but I think it's important for us to understand pregnancy as earlier. Like let's say when our mothers gave birth, the mortality rate of women during pregnancy was very high. Right, like there was a very high risk of women dying during pregnancy and etc. So because of also lot of healthcare improvement and etc., the mortality rate has drastically reduced. Like now we have interventions for pre-eclampsia, there's medicines for pre-eclampsia and etc. So right now, as the mortality rates reducing, I think we are slowly beginning to understand the mental health of women, right? As the physical health, we are able to focus, or we are able to provide a good medicinal care or the physiological care for women during pregnancy. Now there is a importance or focus that's given more to the mental health of women, right? And especially in the last, let's say, decade, there has been a lot of growing literature on mental health for women, but I think we're still at the beginning stages.
Yeah, it still need to grow, because when I was pregnant, I focused more only on postpartum. I totally avoided the perinatal period. I knew something was there because we've studied, all right, but being a psychologist by myself, I totally avoided concentrating on the perinatal period.
Absolutely. And there is less concentration on the prenatal period as well.
Exactly,
right?
The same.
Yes. So it's like people think that women are to be naturally happy when they get pregnant. So there is a social construct towards pregnancy as well.
Expectations.
That comes in, that says 2 months you have to get pregnant. The first month you have to get pregnant. 1 year you have to get pregnant. If you're finished with one pregnancy, when is your next pregnancy? There is a lot of pressure that's added on. So what we do is, it's important for us to screen for mental health, just like how you go for your scans. It's important for mental health screening also to come in during the prenatal period itself.
That's a valid thing.
Yeah. Because there is a lot of focus on postpartum, because postpartum is different.
Yes, very much it is different.
There's another human being that's involved in your life.
Yes, in hand.
Yes, in hand, right? And but it's important to understand that identity change does not come in after you give birth, right? But it comes in the moment you conceive, right? So it's important for us to start the focus right there.
Yes.
Right? So there are states that has implemented mental health screening as part of their OG checkup itself, right? But we are still yet to get there.
Okay, because when I was during the postpartum period, the focus was more on the baby.
Yes.
The love care affection was more on the baby.
Yeah.
Being, studied about that, I was not able to accept the fact that why people, my own parents were more focused only on the baby. During the perinatal, I was not, left alone.
Yeah.
There was so much of, love. The amount of love increased back then. So actually with that note, it has to be taken care. The parents' role also comes over there.
Yes.
Isn't it?
Yes.
So how is it differs from the previous generation to this generation? Like the previous, few decades earlier and now, is parents are really involved in this perinatal period, especially when the woman is identified.
Women is identified saying that she has a difficulty. I think that's a valid question, right? Because the family support is very crucial during postpartum period, right? And when women are dismissed or invalidated about their emotions that they feel, like what you said about how the love all of a sudden shifts.
Yes.
Not just with your parents, right? But it's with everybody. Like including your husband for that matter.
Yes.
Like the focus all of a sudden shifts to the baby, and it is extremely difficult to process that change. And without family support, it is very difficult. And family support is also one of the indicators as to how emotional well-being can be good when there is a family support that comes in.
I experienced that.
Yes. And family plays a huge and a crucial role in taking care of the mother. I think that's a primary objective that should be during the postpartum, because in prenatal everything is given, like especially in our culture, like there is what we call simandam, the baby shower comes in. Women are adored with jewels, saris, then there is food, sweets, like whatnot, right? The focus is given so much there. But after the delivery of the baby, I have heard so many people talk about how it's very different. So people come in and ask, how is the baby? Is the baby being fed? There are so many critical questions during the postpartum. You are not feeding the baby enough. Your milk is not enough for the baby, right? And there is a problem in you. So you eat this, it gets affected to the baby. So from being in the position of receiving love, it absolutely shifts to being criticized. So anything and everything that happens to the baby becomes the responsibility of the mother. And it's a huge change to process.
Yes, but with all these information being already shared, given and heads up about this, how well this can be understood and learned during the perinatal for the mothers, for the pregnant women. So, because many of us would have, especially for friends when they're pregnant, we will say that, okay, now you'll get all the love and care, but once the baby is born, you'll be neglected. So that will start slowly hitting because for me it starts slowly hitting. It hit me. It hit my processing. So how well can the perinatal mothers, within the perinatal period, how well they can educate themselves and expect themselves for the worse and as well as for the good.
Yeah. So see, information is available everywhere, right? Like social media has played a huge role in providing information as to these are the things that can happen to you. But what happens is, knowing this information, what do I do? Sometimes I see mothers feeling extremely helpless knowing this information, and it feels very stuck. So it's important for you to be aware of these things, but it's also important for you to be aware that knowing these things may necessarily not mean that you can provide that help for yourself, right? It's important for you to understand that I need to seek for help. Like, you can approach a mental health practitioner, or if you feel like breastfeeding is your major issue, you can approach a lactation consultant, you can approach a psychologist, you can approach your family members who can get you help. So knowing this information is good for you to be able to seek support, right? There's only so much you can do for yourself. Is something that needs to come in. Sometimes it's also looked at as weak. I remember one of my clients who came and told me that, sure, I am a mad mother. I'm a mad mother who can't be happy because I've given birth, and that's what my people around me tell me. So me coming to therapy with you means that I'm a mad person.
That is a huge stigma.
Right? Yeah. So then, even if the mother is willing to ask for help, it's important for family to validate that process.
Yes.
So knowing the information is great, but it's also important for you to seek support. And there's no harm in seeing a specialist for like 4-5 sessions.
Yes.
Or how much ever the specialist recommends you to come in for.
You should be allowed to process that, isn't it?
Yes.
Because processing takes a lot of time.
Yes. It takes a whole lot of time, right? And it's important to go with the pace of the mother as well, right?
Yeah.
Like, you want to take 4 months, okay, you take 4 months to process. You want to take a year to process, take a year to process. But can the mother take that call? And so how much can I process at this time? Because there's whole lot of hormones that's working. So there's sleep disturbance that you will have to handle. There's appetite that you'll have to handle. There's the small person that's coming to your life that you'll have to handle, which is a lot of systemic change that you need to
very much.
Yeah, like, and your house has changed for sure.
Everything is it's not as clean. It's not as organized like before.
Yes.
So everything is messed up. So that also affects the the mental state of the mother as well. Because she's being blamed at the end of the day.
Absolutely.
For everything.
Yeah, you come in, you see the house dirty, then you say, oh, you're a new mother, the baby is there, the house shouldn't be dirty, the house is messy. Sure, but look at your mother, she's handling so many things.
Don't criticize, try to help.
Yes.
Otherwise, don't criticize.
Yes, absolutely, right? If you are unable to validate their feelings, then it's important for you to stay away there, right? Because you invalidating them is causing more harm.
Unknowingly,
absolutely.
So another thing is, like, once the mother, when the mother's in the perinatal period, when she sees that some kind of change has been happening to her, mentally, physically, mentally, once she feels that she's been seeing some changes, what should be done? When she's maybe identified.
Yeah, she should immediately seek out to the family members, and if the family members are invalidating, reach out to a professional. That's extremely important. Right?
So what could be the cues for them to identify?
In the postpartum period, the first cue that will start will be sleep. The mother will feel sleep disturbances, that it will be very difficult to go to sleep. She will wake up in between the sleep as well, or she will be oversleeping than her normal routine, right? Yeah. And then the next will be the appetite drop. She won't feel hungry at all, or she will feel overly hungry during that period. There will be crying spells, like there will be thoughts about herself that she's unable to handle, like things like I am not a good enough mother, I am unable to take care of the baby, I'm unable to understand the baby is constantly crying,
suicidal thoughts,
harming the baby, in extreme postpartum psychosis. You will see that the mother wants to take the baby's life, take her life as well. There can be thoughts like I'm unable to bond with the baby.
The bonding has been a major issue for me also.
Yes.
It took at least 2 to 3 months.
Yes, and it's perfectly alright
It is
for you
alright.
to take that time to bond with the baby, right? I remember when I delivered the baby, the 3 days, the nurses were like, "Oh no, you're not cuddling the baby, you're not saying sweet things." I don't feel like saying sweet things to the
Don't
baby.
impose, don't force. It should come out of love.
Yes, yes.
You should not do that.
Yes. So I was like, oh my god, am I supposed to do that? Like, what should I do? Everybody talks about you delivering via C-section normal is alright.
That's the first question.
Yeah, but it's important for you to also remember that it's alright, the mother doesn't feel like bonding with the baby, and can I give her that time and space to come back, right? That's extremely important. So another thing that you will see is that any signs of depression and anxiety is extremely high, because in our recent studies we see that at least about 16% of women experience postpartum depression during the first year of after they've given birth, and the numbers have increased rapidly after COVID. So it's about 36%. In my MPhil thesis, I realized that 32% of women were depressed during their postpartum period, and at least about 8 to 12% of women were having symptoms of anxiety and depression during their prenatal period. So there are signs and symptoms that women show during the prenatal period itself that can be an indicator for your postpartum also.
Okay, so can I take it like this? Like, if the cues have been, arising during the prenatal,
yes,
then there can also be depression, there can also be anxiety.
Yes.
So are the many cues.
Yes.
Yeah. So are the many cues like one or two?
Like the sleep, like the appetite drop, like the restlessness. They feel like I feel very indifferent towards my pregnancy.
Okay, they not like it or they like it.
They may have planned for it, but once they've got pregnant, they may not feel the bond there. Right? They may not feel like, oh, I'm pregnant now. It may not strike them, and it's all right, right? But what comes in here is the critical thoughts of, oh, you should be feeling this, you should eat this, and the mother starts feeling extreme pressure that leads to anxiety of, oh, I should be typically feeling this, but I'm not feeling this, and slowly the anxiety seeps in, and the mother starts thinking that, oh my god, she starts worrying. She's starting to think that, oh my god, what am I going to do with this baby? The baby is going to come out. So the mother is dreading about postpartum already, and is dreading about the delivery as such already. So there's fear that's seeping in. So there are many scales that we use to assess the prenatal anxiety and depression itself.
Okay.
And once the indicator comes in, when we intervene, we see that the mother is able to manage her postpartum well.
Oh. So it is, whether the cue has been arised or no, it is always best for own well-being for the mother to, during the perinatal, especially pregnant women, during the perinatal period, to get a mental health checked.
Absolutely.
Yeah, it's not wrong.
It's absolutely not wrong, right? So it's important for the obstetrician to do a mental health screening or send the mother to a psychologist for a mental health screening, where the mother meets the psychologist or anybody, a mental health professional, just like how she's meeting a obstetrician, right? It's extremely important for the screening to be done every trimester. The first trimester, second trimester, the third trimester, because the symptomatology varies from each trimester.
Okay.
And there is no harm in going as a couple to see a therapist.
So it's no harm in going during that time. It's not like you after you encounter something and then you go. It's better late than never.
Absolutely.
So in what ways are the working pregnant mothers different from stay-home pregnant mothers' mental health, especially during the perinatal period?
Yeah. See, majority of women are in workforce now, right? There are very limited research literature that talks about working and non-working mothers, and we've been getting different results. A lot of people, a lot of research talks about how working mothers are more stressed during their postpartum period, but there are also a lot of research that talks about stay-at-home mothers having a lot of anxiety and depressive issues, right? But what I feel is that working mothers have this guilt of, oh, I'm a working mother, I'm unable to provide enough for my baby. So the working mother's guilt comes in there. Like, I am not spending enough time with my baby, I'm not doing enough for the baby. A lot of people say things like, oh, you're just working, it's not as bad as staying at home. But stay-at-home moms are also said things like, what more can you do? So there is a guilt component in the working mothers, and what more can I do and what am I going wrong is a lot at the stay-at-home mothers.
Okay.
But both the community, both working mothers and non-working mothers, are equally affected in this process. It's important for us to understand that, of course, there's a differentiation in terms of how much time this mother gets outside the baby.
Yeah, when you look at the brighter picture, the working mothers get some space and outlet to get some fresh air.
Yeah, but that's sort of covered with the guilt component. Oh, I'm spending more time with myself and that's not okay, while I should be spending more time with my baby. So me time is not okay, or me time is looked at as a selfish component act. Like, you're so selfish, you're leaving the baby and going for work, right? Is also a component that comes in, right?
Very much.
So it becomes very difficult to navigate through the social construct for both mothers. So both mothers sort of experience very similar,
maybe little, just not equal, we cannot say equal amount, but here and there it more or less the same.
Yeah, it can be like, the issues that I may face is different, but at the end of the day, my problems are the same. I still feel anxious. I still feel a little depressive. I still feel these symptoms, right? The manifestation of both are little different, but it still comes down to me not being okay.
So that's when they can start analyzing themselves to why and when they should look out for help. Which is very much needed, especially for working pregnant moms. So next would be like, I would like to know, like, since you have worked with clients, like, for around that area, how much is the husbands are involved, and after that, what can they improvise in terms of their betterment of involvement?
I think that's an important factor, because currently we have good literature on women, but we are still building literature on fathers, right? But it is inevitable that fathers also undergo a lot of identity change during the pregnancy process. It's equally pressuring for them as well, because I think we are looking at fathers as financial providers. So I remember a lot of people asking, oh, you're going to get a baby, so are you have you bought a house? Have you done an LIC? How much financially stable are you? So fathers do undergo these sort of pressures from others as well, and since it's an identity changing process for fathers as well, fathers also go through similar symptoms of anxiety, like restlessness, mood changes, sudden, what we call that palpitations, right? Like, all of a sudden they feel that they feel very scared as to what I'm going to do.
First thing, scared. And the biome. That's the first factor which
absolutely
strikes more than the happiness. That because many people think that sandoshapadama vandittu you're feeling scared, but actual fact, the one is feeling the pinch is the couple. The father especially. The mother, in a different genre, but when it comes to father, the more pressure is on them.
Absolutely.
You have to look at, you should have to go work outside, get back home, look after the wife, provide for your wife. All the other components have been.
Yes, but you know what happens here? The catch here is that these are things that are ignored. So, because we're still under the patriarchal society, fathers don't seek out for help.
Yeah, they like, men should not cry.
Yes, yes,
Men should not, feel
Yes.
sad.
yes.
They are the strong, and like bodybuilders nale, it is
Yeah.
only men.
Yeah, yeah.
It's not like that.
Absolutely.
Men do have feelings, men do have emotions, which is that they want to break down. They too want to have meltdown, breakdown, but they are not allowed to.
Yeah.
It's only because of their own mental blocks.
Yes, and the social construct that you have internalized in you, right?
Yes.
But what I've seen beautiful here is that when fathers work through this process along with mothers, you break generations of trauma in the process, and it is so beautiful to see the couple evolve during that time, because you're able to support each other during this. You're able to handle the triggers. You're able to establish boundaries between you two. You're able to take equal support in providing care for the baby.
Yes.
And you are not looking at yourself as, oh, I am also taking care of the baby. That sort of sense doesn't come as a superior.
The demanding.
Yes, but it comes more from a grounding space of, yes, you are also taking care of the baby, I am also taking care of the baby. So the responsibility becomes split there.
That's much important.
Yes, and so nobody is superior to one another here. There is an equal responsibility sharing in parenting, and you see that provides a greater impact for the child as well.
True.
Right? So men in therapy break a lot of generational trauma that we've had.
Have you seen any, in your clients, in your therapy sessions, have you seen any, fathers actually, opened up about it? Are the fathers opening about it?
Fathers are slowly opening about it.
Okay.
But there are very small numbers. Like, even if you see, I don't know if it's just my clientele, but I've heard from other colleagues of mine as well that a lot of women are in therapy, but less men are in therapy, right? But we have to have more men in therapy as well, so that men also begin to heal from this process. But I have seen fathers work through these issues beautifully.
I think only by this they will realize, oh yeah, I did undergo this.
Yes.
I was not aware.
Absolutely. So when you are aware, you are able to appreciate and validate and be empathetic more.
Yeah. At least yes, they can spread the good news.
Yes.
So what is suppose if in case, if the father they want to do, but due to the family, if they're staying in a joint family, or even they're staying alone is fine. If they're staying in a joint family, but they want to do, this is not the men's job, this is women's job, there's always that, stigma. If that is the case, like what would be the smallest of things which you would suggest the fathers can do during the perinatal process?
Ask your wife. It's important to ask, right? A lot of times we assume. So it's important to ask what she needs, how much she needs, how can you be of help, right? That asking will make such a huge difference, because it sort of sets in your mind that, oh, there is somebody who's willing to ask, who's willing to support me in this process. And I've seen when fathers bring in their wives during the perinatal period for support, and they are also willing to be part of the sessions, I see that it brings in some amount of feeling that, oh, I can do this. My husband's there to support me.
Confidence.
Yes, like the confidence, right? Like, I can do this. And the second thing is validate emotions. It can be very silly, right? It's important for you to not make fun of those silly things, but it's important for you to validate and give importance to what your wife is feeling at that moment, right? And the third thing that I want to say is, seek for support. When you know that this has been continuously happening to your wife, and you see that she's struggling, please do not hesitate to take her to a therapist, right? That's extremely important, because once you support her in this process of breaking stigma, then you see that she recovers very fast in that
It's
state.
a team. It's a teamwork.
It's a teamwork. Absolutely, it's a teamwork, because it's important to look at you also as pregnant during this journey, and you're also going through a lot of things, and so is your wife.
Definitely. So even husbands should also not hesitate to open up about their emotions and feelings. They can come up with it.
Yes.
They can obviously let it out.
Yeah.
But in a healthy way, provided.
Yes.
It's always acceptable, isn't it?
Okay.
So what can you suggest some available resources for them, for the prenatal mothers to reach out to seek out for help? So what would be the available resources which you can suggest?
Yeah, so if you look at the government resources, Government Institute of Mental Health offers a lot of support. We at Smriti Healthcare provide a lot of perinatal support for mothers. If you want to check out online resources, you can check out NIMHAN's website. The NIMHAN's perinatal department is huge and well established. There is also the Green Oak Initiative by Dr. Ashley Shabagadia, who's a perinatal psychiatrist and who does a lot of work, runs group for pregnancy mothers.
Okay.
So these are few people whom you can reach out and approach for perinatal mental health. But I would suggest, please, if you're pregnant, please get yourself screened first for mental health.
Both husband and
the wife, right? That will be a huge and a great step,
because eventually it will help your postpartum period.
Absolutely.
Whether you experience postpartum blues or postpartum depression doesn't matter.
Yes.
Because the hormones drop is going to be there no matter what.
Yes.
So it's going to help.
Yeah. And reach out to, there are also people who does a lot of good work, like in lactation, in terms of lactation consultant. In your postpartum, if you find breastfeeding as a difficulty, reach out to a lactation consultant. There will be people who are saying, we all breastfed, we all did that, right? But it's alright for you to reach to a professional
lactation consultant.
Yes, lactation consultant, a psychologist, a clinical psychologist, who's willing to provide that support for you, right? Speak to your pediatricians, speak to your obstetricians, ask them questions, ask them how your mental health is going to be taken care in this hospital. It can be very simple as a supportive nurse during your pregnancy journey.
Yes. Nurses are angels, especially during this period.
Yes.
So they got to be real angel.
Yeah. And in terms of providing you information and etc., you need to ask for support.
So what happens during the postpartum period?
Okay, so what women experience within the 48 to 72 hours is what we call as postpartum blues, right?
Yes.
And about 40 to 50% of women experience postpartum blues, where there is a sleep appetite disturbance, where you feel very low in mood or high in mood, you feel depressed, you feel like not talking to anybody, you want to just sleep, what we call as postpartum blues. But typically postpartum blues should disappear, right, in a week or so.
Maximum 2 weeks.
Yes, maximum 2 weeks. And then what we call it as postpartum depression.
Yes.
Where there is significant depressive symptoms in your postpartum period that can last, if unattended, can last for your lifetime. Also, the trauma can stay. Right?
Yes.
A lot of women come to me 4 months, 6 months when they are settled with the baby, they reach out for help. So that's postpartum depression. Another serious mental illness that we consider is postpartum psychosis that occurs in about 1% of women during their, where women lose their sense of self and go into a severe mental illness is postpartum psychosis, which is very rare, which occurs in about less than 1% of women. But postpartum blues and postpartum depression and anxiety are pretty common.
So with me, when I was in the hospitalized, the first day was fine. It was like, I have a baby and all. Second day was okay. Third day, it hit me hard. I had a huge meltdown. When I was alone with my mother at that point of time, My mother couldn't process. They were like, her only concern was like, oh, don't cry. Your milk supply will not be there. I was not allowed to cry. I was like, don't cry. You should not cry. It will affect the baby. It will affect the baby. It will affect your blood, milk supply. So what happens, like, when such comments pass through for the delivered mom? So how can the mom grieve through it? Or not grief, at least process the pain by not giving ears to such comments.
See, I think at that time it is inevitable those comments will go in your head, isn't it? Like, because it's your own mother probably will say things, it'll be your own father, it'll be your own husband who will say this, or even your own doctor might say these things.
My doctor was not bothered. She was like, this is how it is.
But it's not okay, isn't it? So it's important. I think I want to repeat this again, that it is inevitable that these things will hurt you, but all the more important is for you to understand that this is not okay. Like, people invalidating your emotions, people invalidating your meltdown, your doctor saying that iprada iruko is not okay, right? So it's important for you to understand what is okay and what is not okay, right? Because what they're saying is very unhealthy. Because we see that at the age of 40, 45, the postpartum wounds are carried till 45, 50.
Yes.
I have women who are in their 40s who are still grieving for that pregnancy process, right? Because it's been bad. It's not like once the child grows up, you will outgrow this. The aspects, the few things that the experience that you have had during your pregnancy are going to be part of you. This is like saying a child who's abused will outgrow it.
No.
Exactly, right?
Trauma's trauma.
Yeah, trauma's trauma. The child is never going to outgrow it till you provide the child enough support so the child can build resilience and coping and is able to feel safe, right? So same way, this trauma can also be carried in different ways, right? Like, I've seen the productivity declines drastically. The mental fog remains. They are unable to concentrate. They're unable to concentrate in the kitchen. They socially withdraw themselves, and it takes so much time to go back when this trauma is unaddressed, right? So this is very important. For the women, I'm very sure it's extremely challenging to go against your family. If your family is not supporting, if your family is saying no, this is bullshit, it can be extremely challenging to reach out. But there are communities, there are groups that you can reach out to. Like, I run a support group for women who are pregnant. It's for pregnant women. It's a small group. It's an ongoing process. We meet for only like 5 or 6 sessions. Short-term group. There are long-term groups. So it's important for you to get yourself involved there. So even if you don't go for an individual therapy per se, you still feel that support from the other women who also mirror your needs and wants. That's extremely important there.
Because only then you will know you're not the only one sailing in the boat.
Yes.
You have someone else also, which can also be. You never know how the ray of hope comes in nowhere from nowhere. So it's always look out for support first. Then look out for help. Secondly. So
and reach out to a lot of people. Even a friend can be supportive. Right?
All they have to do is communicate. The end of the story.
Even if you are unable to say it, if you see the women is finding it difficult to comprehend, I think it's important, it's a responsibility. It's our responsibility as clinicians, as friends, as mothers, as fathers, to see and observe that there's something wrong with
probe with some questions to make them talk it out. Come out of it, because they might be under assumption that if I say this, will I be validated?
Absolutely.
If I say this, will I be considered? Will I be heard? Will I be understood? So that stigma has to break down first. Only then the rest will fall in place.
See, one of the things I see that I use to get the family to support is to tell them how postpartum can affect the child as well, right?
Exactly, not just the mother.
Yes. So there are a lot of studies that talks about the importance of early attachment, right? How the early attachment plays a significant role in later stages of your life. There are so many studies, and the early attachment gets formed only with the mother first. So
Mainly.
yes, so it affects the baby to a large extent. So it's important for you to first get the mother some help so that the impact of the baby is minimized or is balanced or is reduced. So when I inform the family about how it can impact others and how it can play out long term, the family is willing to then support in this process.
So when they are told, they are being heard.
Yes.
They are heard.
Yes. There is some hope.
Some hope. At least some change.
Yeah. Yes.
If not, one day.
Yeah.
At least one day at a time.
Yes.
So that would be really great if this blooms, this understanding, at least the tendency to ask questions,
Yes.
communicate and understand and validate is more than enough.
Yeah.
Rest will fall in place.
Absolutely.
So thank you, Kanaga. It was very much valuable because many people would have spoken about it, but it is also important to keep repeatedly talking about it because our mind is programmed in one such way where things have to be repeatedly spoken and talked about it to get fixed.
Yeah.
So definitely it's going to be eye-opener, especially for fathers who can actually watch and get to know more about how to ask. And how to communicate. So I hope people gain something out of this video. I'm sure they would have with your valuable information. So thank you so much for your time.
Thank you so much for having me.
My pleasure.
It was really great talking. It was really great catching up.
Thank you.